I think that one of the sort of really breakthroughs in terms of aggressive lymphomas recently sort of fall into two categories. I think one of the first is CAR T cells. And we do know that these can be effective in the setting of Richter's transformation, but the outcomes are still not as good as we would like them to be. They're not as good as what we see in large cell lymphoma alone. And so there's a couple studies going on trying to look at whether we can improve upon CAR T cell therapy and if we can make those cells work better. A lot of the thought is that maybe some of the immune dysfunction of CLL, having that for many years, sort of might make the cells not work as well. So there's a couple of interesting studies that are going on in that space that I think will be interesting to see. In addition, one of the other really sort of big advents in aggressive lymphoma therapy has been the emergence of these T cell engagers, or what we call bispecific antibodies. These target both a molecule that's on T cells as well as molecules on the lymphoma cells and bring them into close proximity so the immune system can fight against the lymphoma cells. And there's been responses reported in some of these initial studies in Richter's transformation. Granted, numbers right now so far are low, but I think looking at those strategies in combination with other effective therapies is a strategy that's being looked at in multiple clinical trials right now. And so that is, I think, one of the other spaces. So I think those two main areas of immunotherapy will be very interesting to look at clinical trials. I would say that right now, biopsy still remains really essential for this diagnosis. And I think that's something that cannot be underemphasized enough. Biopsy is not only needed to establish the type of histology or type of transformation, it's most commonly large cell transformation, but we can see other types of aggressive lymphoma transformation as well. And in addition, there's some mimics. There's some things that can look like transformation that actually aren't transformation, whether they be other cancers or sort of aggressive proliferation of CLL or a flare that can happen sometimes after stopping BTK inhibitors. So I think I would sort of really emphasize that biopsy is really important in making the diagnosis, and it's not something that should be made on clinical suspicion alone. And then lastly, because clinical trials are sort of rapidly changing and may offer patients the opportunity to get therapies that otherwise may not be accessible to them, I think really trying to seek opinions or care at a center that sees a lot of high volume CLL and Richter's cases is really encouraged, because I think it gives patients the opportunity to potentially get one of these novel clinical trials in their therapy.